an epidemic, and I'd like you and also for Dr. Shi to comment on that since they're co-sponsoring this event.
Okay. Oh, Andy, stand up here. Well, let you answer this.
So why don't you answer first?
He said he wanted to hear from you, Andy.
So the question is, can you repeat that, please?
Isn't the CDC exactly the wrong agency to be looking for causation given the concerns of so many parents that vaccines cause their child's injury and autism?
Right. So I don't think Autism Speaks in the position to answer that question, right? So this is obviously a federal government issue.
Why are you co-sponsoring this event then with, or why are you up there with?
We're not co-sponsoring this.
Well, why are you up there?
I'm reporting on the cost of autism related to the rise in prevalence rate, which is absolutely alarming, absolutely. What I can tell you is Autism Speaks is actually very proactive, investing in research, looking at risk factors related to autism. So some of the risk factors that you've heard of today, for example, low birth weight, prematurity, increased age, they were actually result of research that are partly supported by Autism Speaks. So we are very proactive, and we believe that you can accelerate science. You don't have to wait 10 years for results.
Thank you. And I will just say that, again, we talked about the Children's Health Act, and we didn't write the Children's Health Act. Congress mandated us to do what we're doing. So I think you're asking the wrong person when you ask us why we're doing what we're doing. So you might want to ask others about that. Other questions? Yes?
So then does the SEED project, does that look at things like, you said environmental factors, but you be a little bit more specific, does that look at things like vaccines and pollutants that are in the air and things like that?
So we have a definition of environment that's very broad. And for us, environment means everything that's not genetic. When we were authorized to look at these risk factors for autism, there was an existing study that's called CHARGE that's funded by the Mind Institute that's looking very specifically at toxins. I believe for many people, environment means toxins. And we looked at what they were studying as part of their study, and we decided that we went to the literature and we looked at where the gaps were. We spent a year or two reviewing the literature and looking at what are the research questions that are not being answered. So we're focusing on things like hormones in the mother, factors, socio-demographic factors like maternal, paternal age. We are describing the phenotype well, and we're not looking at toxins per se. We do have hair samples from the first phase. We're in our second phase of the study. And in the first phase, we collected hair samples to look at mercury levels because we understood from the literature at that time that that was the best way to measure mercury levels. And we are collecting a lot of information from medical records that includes information on health conditions of the child, and it probably will include when the child received vaccines. But it's not a major focus of SEED, and the reason is because we felt like there were a lot of other research questions that no one was tackling, and we thought that it would help, it would move science forward if we could look at some of those other factors. Other guy? Yes? Yes, you.
Okay, hi. My son Philip is 23. He has autism, so unfortunately I've had a front row seat to this debate for 23 years. And I wondered if you or perhaps Andy would like to speak on, particularly so the staffers understand that have generously given the time to be here, because I think those are the people that this gentleman wants to speak to as much as I do. And my question is, I don't think you guys are really good at what you do, and it doesn't appear that you're just getting better at what you do and we're going to flatline, because I read this study from South Korea, and maybe you or Dr. Shi could answer, is that predictive of where we're going? And when you guys revisit this issue in 2 or 4 years, is it going to level out, or are we going to keep going up? I mean, I think that the congressional staff needs to hear what's going to happen. I'm worried.
So, of course. So the Korean study is funded mostly by Autism Speaks, and we took a different methodology in terms of case finding than what's being done at Adam Network. And so the idea in Korea was that we were looking at a population-based sample and literally went door to door, not just looking at administrative records, which I believe is the primary source of information from the CDC studies. And when we did that, we found that not only were there, many cases in special education programs, so on, and the proportion is very similar to what we have here, close to 1%. However, when we went to the general population, went to the general school, the mainstream school, we actually found an alarming almost 1.6, 1.7% in the general school. And so what it suggests to us is that the way you try to identify the cases in doing a epidemiology study is obviously very important. So as a result, we were able to work with the CDC. We talked about whether or not we can try to replicate that methodology we use in Korea in some of the African sites. And the result is actually we're now funding a pilot in South Carolina, I believe.
South Carolina,
Right.
correct.
We're actually replicating the methodology we used in the South Korean study to see if there are differences in terms of the number of cases you can identify using this more comprehensive, what we think are more comprehensive approach to finding cases versus just pure administrative record review. So I think the information about that will help us understand, where are we doing something that's not quite, kind of lacking? Can we do a better job in finding more cases and actually delivering more accurate information or data to our community?
And I think this is a great example of a public-private partnership. We have worked closely with Autism Speaks for many, many years, a lot of different efforts, and we appreciate so much the opportunity to look at this in one population in the United States. That study did raise a number of questions. It is in Korea, it's not in the United States. We don't really know what these children were like. They were sitting in classes, not receiving any special services. Is it likely that that could occur in the United States in a different environment? We really don't know. So, and it didn't talk about severity. I mean, there is no measure of severity for autism. So again, if these children are in classes and they seem to be doing well, we don't have a good measure of their severity. So it raised a lot of questions that we are anxious to try to answer. Thanks to the funding from Autism Speaks, we hope we'll have an answer in the next couple of years. Yes, I'm sorry, you've already spoken. I'll call on someone else for right now.
Hi.
Yeah.
Hi, my name is Louise Habakis. I come from New Jersey.
Oh, great.
And New Jersey is the number 2 state in the ATOM network in terms
Right.
of incidents. 1 in 29 boys has autism in my state.
Mhm.
And I think New Jersey is a sign of things to come for this country.
Mhm.
Dan Olmsted in the back had asked about vaccines in particular, and I'd like to bring up this question again, because in New Jersey, we mandate more vaccines than any other state in the country as a condition of daycare and school admission. And it seems that if lots of parents are concerned about vaccines, and it seems that if you look at some of these states that have high mandates, high compliance, high level of pharmaceutical company presence, worldwide U.S. headquarters for a lot of companies, parents would like to see some good faith, I think, in terms of government and NGOs coming together to say, okay, let's look at the 500-pound gorilla in the room. Let's really look at vaccine exposures. I don't think parent groups are saying it's only the vaccines, it's just vaccines causing all of this. But clearly, it's an exposure that's universal, it's widespread, and it has increased dramatically. It's been a 3-fold increase in the last 25 years. So I'm particularly stunned when I hear you talk about seed, which I think is very promising. Well, why would you look at things like, maternal hormones and parental age and obesity and other things without looking at vaccine exposures? By the same token, with Autism Speaks, you need to be looking at vaccinations. It is the largest exposure that children receive universally, happening consistent with this increase in autism, irrespective of urban, rural, socioeconomic, religion, diet, practices. One other thing I just want to say, I think it's very interesting that if you look at research, it indicates that parents that are foreign-born have children with a lower incidence of autism than parents that are U.S.-born. I think that's really telling. It speaks also to environmental exposures. I think this is all worthy of inquiry.
Thank you very much for your comment and question. I didn't want to make it seem that CDC is ignoring the vaccine question. CDC is not ignoring this question. We do have a very active group at CDC, that looks at vaccine safety, for example. Because a number of the questions don't have to do with a specific vaccine. We did look at MMR vaccine, we looked at thimerosal-containing vaccine, and I think the shift has been more toward total number of vaccines and vaccine load, and other types of questions that, to be perfectly honest, are not my area of expertise. But I assure you that if you contact people at CDC who are responsible for vaccines, that they can give you information about their research portfolio, and this is a concern of many. It's just that specifically it's not our area of expertise to go into some of the questions that parents do have about vaccines. Next question or comment?
How will the proposed change to the diagnostic criteria impact your ability to track?
Okay. Thank you for that question. We actually have been, although we are not on the, and I think everyone's aware that the DSM-4 that we're using now as our diagnostic classification system for autism is, there are proposed changes to this, and it will be DSM-5, and it's supposed to be out in 2013. And there are two major changes that are being proposed, and again, I keep saying proposed, as part of DSM-5. The first is autism spectrum disorders would be the one category that will capture all of the children and individuals now captured under autistic disorder, PDD, NOS, and Asperger. There will be only one term, which is ASD. The second is that there will be another condition that's called social communication disorder, and we don't know if some of the children and individuals that have a diagnosis of PDD, NOS, or Asperger that are higher functioning will now be captured under this new category of social communication disorder. But be that as it may, we have done some preliminary analysis of our data, and it may be that the prevalence will change, it may be lower. However, as John explained about our methods, we capture not the diagnosis per se, not the clinician's impression, not just the autism exceptionality in schools, although we do capture that. But our method allows us to look at the autism behaviors. And so because we're capturing the description of the behaviors, it doesn't matter how this is categorized, if it's DSM-4, DSM-5, or even DSM-6 in the future. We can go back and look at the data that we've collected, and we can apply whatever the current diagnostic scheme is and tell you what the prevalence would be according to the criteria that we've established. So I think that our methods allow us to tell you what the prevalence will be in the future, regardless of whether DSM-4 changes or not. So I think we're in good shape with that, and there have been some field trials, and in the field trials, not our data, but in the field trials, I think the prevalence has been shown to be lower using the DSM-5 criteria. I know there's a lot of concern about that. Yeah. Okay, Peter.
So obviously this birth cohort back-to-the-end study was born in 2008. The study was published in, 400,000 8-year-olds in 2008, my apologies.
Right.
So study is then published more than 3 years later in March of 2012. Can you walk us through the process in which you collect the data, how it comes to you all, and then what happens from the time you get the data and the time it gets published? And finally, do you think you can do better and faster?